What if I told you that the reason your tendon pain keeps coming back isn't because you're not trying hard enough, but because most treatments are missing a key piece of the healing puzzle? Hi, I'm Dr. Jason Hahn. Today, I want to explain why tendon injuries are so frustrating and what we can finally do about them. Specifically, I'll walk you through how a cutting edge combination of radial shockwave, focused shockwave, and EMTT is changing the game for healing. If you've been dealing with tennis elbow, Achilles tendinopathy, or shoulder pain that just won't go away, this might be the solution you've been looking for. Here's the thing. For years, we've been told the same advice: rest it, ice it, take some anti inflammatories, and hope for the best. Maybe get a cortisone injection if it doesn't go away. But these treatments are designed to reduce pain, not to heal the damaged tissue. And if you've been through this cycle, you already know the pain tends to come back. The big reason tendons are so stubborn is because they don't have much blood flow. Blood is how your body delivers healing ingredients like oxygen, nutrients, and immune cells. So when you injure a tendon, your body wants to repair it, but it's like trying to build a house without enough bricks or workers. It's a slow, inefficient process. That is why your tendon pain can drag on for months or even years. This is where regenerative therapies comes in. Let's start with radial shockwave therapy. This sends energy across a wide area and is great for treating superficial tendon problems and tight muscles. It helps reduce inflammation, improves circulation, and prepares the area for deeper healing. Then there's focused shockwave therapy, a more powerful, precise version. It targets deeper tissues with pinpoint accuracy, perfect for areas like the Achilles tendon, the rotator cuff, or chronic joint pain. It triggers a cascade of healing signals and helps wake up the damaged tissues. Now, add in EMTT, also known as Electromagnetic Transduction Therapy. This uses a pulsing magnetic field to energize your cells from the inside out. It improves how your cells use energy. It reduces inflammation and boosts their ability to repair themselves. We often use all three together: radial to address surface level tightness, focused to zero in on the problem spot, and EMTT to activate healing deep within the cells. This isn't just layering on tools, it's building a full healing strategy. Here's how this works at the biological level, but in simple terms. Shockwave therapy creates tiny, controlled stress in the tissue, almost like micro injuries. They don't harm you, but they send the signal to your body that says, hey, we've got work to do here. Your body responds by increasing blood flow, sending healing cells to the area, creating growth factors like VEGF to build new blood vessels, and releasing proteins that help build strong collagen fibers. At the same time, it disrupts pain signals by reducing a chemical called substance P and resetting the nerves in that area. That's why many people feel less pain even after just 1 to 2 treatments. EMTT works at the cellular level. It helps your cells recharge like plugging in a drained battery. By improving energy flow, reducing inflammation, it makes your body healing systems stronger and faster. Combined, this duo stimulates real tissue regeneration, not just symptom relief. Let me give you an example. A middle aged runner came in with a chronic Achilles issue. He was limping, he was frustrated, and he had tried everything: orthotics, rest, injections, you name it. We started him on a combined protocol: radial shockwave for the surrounding tightness, focused shockwave directly at the tendon, and EMTT to reboot the healing process. Within 3 sessions, his pain started to ease. By week 6, he was jogging again. By week 12, he was competing in local races. No surgery, no drugs, and most importantly, no pain. And let's be honest, it's not magic. Healing still takes time. Just like you don't get fit from one workout, your tendon won't rebuild itself in 1 session. Most people start feeling noticeable relief after about 3 treatments. But full recovery often peaks around 12 weeks. That's when the tissue has fully remodeled and strengthened. Think of it like planting seeds. You have to water them, care for them, and be patient while they grow strong roots. I know what it's like to feel stuck in pain, especially when you've tried everything. It can be draining, not just physically, but mentally and emotionally too. You start to wonder, is this just something I have to live with? But the truth is, you don't have to. This approach is working for people just like you. It's not about masking the pain, it's about healing. And here's the other half of the equation: movement. These technologies jumpstart your healing, but rehab is where we build strength and resilience. We will guide you through specific, progressive exercises that teach your tendon how to handle the stress again, so it comes back stronger than before. It's not just about feeling better, it's about staying better. If you've been stuck in a cycle of tendon pain, it's time to stop hoping and start healing. This trio, radial shockwave, focused shockwave, and EMTT, offer a real solution backed by both science and results. You don't have to settle for short-term fixes anymore. With the right tools and guidance, real recovery is within reach, and it starts with taking that first step. Schedule a consultation if you've been dealing with long-term tendon pain. Share this video with someone who is ready for a different approach. Follow us for more real-world solutions that combine cutting-edge therapy with compassionate care. Your recovery isn't a question of if, it's a question of how. And with the right approach, it's closer than you think. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.